talked about left atrial enlargement, we've talked about right atrial enlargement, but you can, in fact, hypertrophy and enlarge both at the same time. So, what is that going to look like on your 12 lead? Well, that's a pretty easy answer because you're going to see signs of both. So maybe we're looking in our limb leads, and here at the top I see P pulmonale, so a sign of right atrial enlargement, a big peaked tall P wave. Then I go to V1, but I see that it's a biphasic P wave, but the second negative half is larger, bigger, wider than the first half, which is a sign of left atrial enlargement. Well, if I see signs of both, then I have both. I have biatrial enlargement, and that's what we're going to document it as, is biatrial enlargement. Same thing at the bottom. Maybe I have P mitral. I've got that kind of M-shaped, notched, wide P wave in my limb leads, which is a telltale sign of left atrial enlargement. But then I go to V1, and I see that the first positive half of that P wave is larger than the second half, which is a sign of right atrial enlargement. So I have signs of both. So don't get confused if you see signs of both. That just means that you have both. So don't overthink this. If you see signs of both, that means you have both. And we're going to document that as biatrial enlargement. Peek at this EKG. So first things first, what's our rhythm? Looks like a sinus rhythm. Here is a sinus rhythm, looks like a first degree AV block with a sinus rhythm. Looks the PR interval looks a little long. What's my axis? Lead 1 is negative. AVF is positive. We have a right axis deviation. I'm taking left posterior hemiblock. Next step, do I have a bundle branch block? And this is a little washed out here, but I think those QRS complexes are just a little bit wide, so we're going to go along with that for the sake of argument. Looking at V1, J point going backwards goes up. We're thinking right bundle branch block. To confirm that, we look at lead 1 and V6, looking for slurred S waves, and I do have those. Lead 1 and V6, we do have some slurred S waves. So I have a right bundle branch block, and I have a left posterior hemiblock, so we're going to document that as a bifascicular block because I've got both of those going on. Do we have left ventricular hypertrophy? Maybe, possibly. Let's look at V5. So V5, V6, what's the tallest? V5 is pretty tall. So we got 5, 10, 15, 20, 25, maybe like 27, maybe up to 30. And then V2 definitely fills in the rest of that 5. Right, so we do have left ventricular hypertrophy, which we can still call in the presence of a right bundle branch block. Do we have right ventricular hypertrophy? Maybe. We just can't call it and diagnose it off the 12 lead in the presence of a right bundle branch block. We can still call left ventricular hypertrophy though, so we're going to call that. Left atrial enlargement, do we have that? So looking at lead 1 and lead 2, do I see any P mitral? Do I see a wide notched P wave? I don't. Do I see lead 2, lead 3? Do I see a tall peaked P pulmonale P wave? I sure do. Right there, so get signs of P pulmonale. We're going to look at V1 and this biphasic P wave. And if we were to measure this out, the second half is actually wider than the first half. So we've got signs of both left atrial enlargement up in V1, signs of right atrial enlargement in lead 2. So we've got signs of both, and we have biatrial enlargement. Looking at this teeny tiny little P wave, your patient might have left atrial enlargement, your patient might have right atrial enlargement, your patient might have both, might have biatrial enlargement, or they might have just this intra-atrial conduction delay, which is this very non-specific conduction issue in the atria. And when you see this, we don't see any P pulmonale, we don't see any P mitral, but you see biphasic P waves in V1. So if you look at V1, we see biphasic P waves. It might just be this intraatrial conduction delay. Here, looking at lead 1, 2, and 3, I don't see, and I know it's a little pixelated, but I don't see anything big and nasty gnarly with my P waves. I don't see any P mitral. I don't see any P pulmonal. But if I look at my V1, I do have biphasic P waves, and they look to be pretty equal in their sizes. So here, biphasic P wave in V1 is pretty equal in its sizes, positivity, negativity. We're just going to call that an intraatrial conduction delay. Same thing here. So rhythm, sinus rhythm, axis, lead 1 is up, AVF is down, I've got left axis deviation, lead 2 is down, I've got pathologic left axis deviation, I'm thinking left anterior hemiblock. I don't have any bundle branch blocks, doesn't look like I have any left ventricular hypertrophy, I don't have any right ventricular hypertrophy. Looking at lead 1 and lead 2, I don't see any signs of P mitral. Looking at lead 2 and lead 3, I don't really see any indication of P pulmonale. Lead 2 is getting a little bit big, but doesn't meet the criterion quite yet of that 2.5 boxes, 2.5 millimeters. But if I look at V1, biphasic P waves, right? So intraatrial conduction delay. And if you want to really get into it, we can look at those, even though we don't see P pulmonale here. That first half of the biphasic P wave, that positive half, is a little bit larger than the second half, so we're going to call it an intraatrial conduction delay, but we are kind of leaning towards you probably maybe have right atrial enlargement. As always, if you have any questions whatsoever about any of this stuff, please feel free to reach out and please let me know.